I'm Todd Wineburner. Appreciate you being here on this Monday afternoon. My next guest is Dr. Dana Cohen. Dr. Cohen is a nationally renowned internal and integrative medicine specialist. She's the author of Quench. It's a book that deals with health through hydration. But today, we want to take a look at the fact that when we get close to a new year, it's natural to start thinking about things we want to pay more attention to, and our health is often a part of that. And Dr. Cohen is here to talk about the fact that women often face challenges that come in the form of silence. That is, issues that aren't even discussed, let alone treated. Dr. Cohen, how are you this afternoon?
I'm great. Thank you for having me.
Well, it is good to have you here because we want to talk about an important issue. We want to talk about the needs of women, the women in our lives, the women that we associate with every day. And you're saying that perhaps women are not getting the full attention of the medical profession. So am I summing it up correctly?
You are definitely summing it up. We learned a lesson a few years back when there was this whole thing about heart disease, and women were absolutely being treated differently than men from doctors because it was thought that they don't get heart attacks as much as men do. And that turned out to be a disaster and not true. And until it was all brought to light, then that now, once we know better, we do better. So it's so important to just keep the conversation going, and exactly what you and I are doing right now, opening up the fields of communication. That's all it takes.
As a medical professional, I just want to take a little side trip because we want to talk about the specifics of certain things women face. But as a medical professional, as you were going through your training and pursuing the credentials that you have, did you think you'd be facing this in 2023, these kinds of issues?
There's so much I didn't know that I was going to face, as a medical doctor. I mean, think about something. We think that we know everything. Doctors like that there's nothing more to learn, and it's so not true. Like, science is ever changing, ever evolving, and so it's I think that's wonderful in many ways. And it's until we, really understand that and keep an open mind as doctors, then we'll be doing a good job, Well,
let's get down to what doctors do. Can you give us an idea of some of the areas that women are particularly having difficulty in? What are some of the things that come up again and again?
Well, I think let's just say it right out loud, menopause. Menopause happens to every single woman in the world, and some of them do better than others, but many don't fare well. And when your quality of life is affected, when you're not sleeping, when you're in pain, when you're depressed, when you have no sex drive, all of those things, there's a problem. And I think it's important to open those conversations specifically with your partner as well, but especially with your doctor, because there are things that can be done and talked about, and it's not just, if you're going through the change and that's all there is to it. That's not true. There's lots that we can do and speak about. I'm just going to bring to light. For many years, there was that whole Women's Health Initiative study that pulled all these women off of their hormones because it was honestly because of the media that it was thought to be bad for you. And only until maybe earlier this year that it was really thought that doctors had needlessly took women off of their hormones when maybe they shouldn't have, and that the risk of being on hormone replacement was not as bad as the media made it out to be. So for example, hormone replacement is a very viable option for many women in menopause. You do need a doctor to discuss that, but it doesn't have to be a prescription hormone. It could be herbs. It could be supplements. There's many ways to do it, but I think it's important to find the right doctor who will listen to you and talk to you and not poo-poo your symptoms and have a conversation with you. So that's a big one right there.
So I guess the question I would ask, being a man, I am a stranger to these issues. So if a woman is not being heard, and I know that this happens because I've actually interviewed other doctors who said, wow, there's nothing you can do. People just have to live through it.
Yeah.
If a woman is not being heard, who should she seek? Is there a way for her to know what doctors might be more receptive to her issues?
Absolutely. So I practice integrative medicine or functional medicine. So find a like-minded doctor that will give you the time, that will listen. I mean, I honestly say my greatest gift to medicine is not my knowledge. It's my ability to listen. I really do. I honestly believe that. I think that that's what makes me a great doctor, is that I know how to listen to patients. And I think that that's something really a gift. IFM.org, Institute for Functional Medicine.org. You can search for like-minded doctors. ACAM, ACAM.org, another way to search for like-minded doctors that practice in this way. You mentioned something about there's nothing you can do.
Mm-hmm.
It is what it is. I hate that term. What comes to my mind is specifically with HPV. Can we just sort of switch subjects just for a second?
Absolutely.
HPV, human papillomavirus. Right now, when a woman gets a PAP and they say you have HPV, the only thing that regular medicine has right now is watch and wait. That's what you just said. Like, oh, there's nothing you can do. You just kind of watch and wait. We're going to repeat your PAP in 6 months and see where we go. When we know that HPV is directly involved with your immune system, so if you have a robust immune system, a good, healthy immune system, your body can fight HPV. So I would love to talk about what that means, and I'm going to give you 3 simple things to do. So if instead of that watch and wait, then you're going to be proactive in your health, and number 1, you're going to start with hydration. I wrote a book on hydration called Quench, and it's, for me, the greatest thing you could do to treat and prevent any chronic disease is learn how to hydrate better. Number 2, stress. Stress plays, we now know that stress kills, right? Stress is not good for us. Mm-hmm. So you have to figure out a way to figure out how are you going to deal with your stress, whether it's, art therapy, talk therapy, meditation, whatever that may be, you have to figure that out. And maybe your doctor can help you, maybe your therapist can help you, maybe your friends can help you figure that out. And then the third thing is, I am an integrative doctor. I prescribe supplements. And I think there is one supplement I would love to talk about. It's called AHCC. It's a mixture of medicinal mushrooms that literally have been shown to clear HPV faster than not taking them. And I think that is incredible. And they've done some human studies. And if you go to ahcc.net, you can find those studies. So 3 quick things to do to boost your immunity and not just watch and wait. And I mean, there's way more that you can do to boost your immunity, but those are just 3 quick ones.
We're talking with Dr. Dana Cohen today, and she is talking about some of the issues that are of particular importance to women, and especially women, as perhaps an impolite phrase goes, women of a certain age. As women mature, they have needs that often are not addressed, and obviously that's a bit of a problem. And Dr. Cohen, we need to move on to something that's even a little more sensitive than the things we've been discussing, because as you say, silence is a problem. And often when people have issues with intimacy, the last thing they want to do is talk about it. I mean, they are even contributing to the silence. So what are your thoughts when we get to this subject? Obviously, this is important to people all over the country. So what can you tell us?
Yeah. So I think opening this conversation, knowing that you're not alone, as a woman, the truth is your male partners experience this also as they age. So I think just opening that conversation, don't be afraid of it. I mean, this is your partner, but also know that there are things that you can do. Now, I'm just going to say hormones are not the answer to everything. As when it comes, people come to me especially saying, I've lost my sex drive, I want to be on hormones. Many times hormones help. It's not the end-all, be-all answer to that, because obviously intimacy is complicated. You've been married to somebody for 35 years. It's complicated, but I think talking about it, finding you have to be proactive, or else if you do nothing, nothing's going to get resolved, right? So I think talking to therapists, sex therapy is a huge field now. Lots of therapists are going into sex therapy, and I think it's so needed, because it is a part of, like menopause, like even getting your periods. This is something that everybody does, and everybody talks. You have to talk about. So. I think it's I don't have the single answer for that. Hormones may be an answer. Herbs may be an answer. I think just opening the conversation is a big answer.
Well, Doctor, we're running a little short on time, because obviously these are huge issues that would warrant more conversation. But here on the radio, the best thing we can do is direct people to places where they can get more information. So you've mentioned some already, but where would you tell people to go if they have the concerns that you're talking about? Where do they start?
So you can go to my website, drdanacohen.com, drdanacohen.com. You can email me with any questions, and I think, I think that's probably the best place to start. If you go to my Instagram feed, which you can find on my website, I always give out some information there too.
Well, Doctor, it has been an enlightening and lively conversation. We appreciate you being here today.
Thank you so much for having me. Have a great day.
You do the same. Dr. Dana Cohen has been our guest. She is an MD. She is the author of Quench. That is a book that deals with health through hydration. We've been talking about some of the issues in women's health